Question 1. Which initial action should the nurse take for a patient presenting with chest pain and shortness of breath in the emergency department? A. Place the patient in a supine position with legs elevated. B. Administer oxygen via nasal cannula at 2 liters per minute. C. Call the rapid response team immediately. D. Encourage the patient to ambulate to relieve chest pressure. Answer: B. Administer oxygen via nasal cannula at 2 liters per minute. Question 2. A patient experiencing a myocardial infarction is prescribed aspirin. What is the priority nursing action? A. Document the medication on the march. B. Administer the aspirin with a full glass of milk. C. Give the aspirin and notify the provider. D. Wait for the provider to confirm the diagnosis. Answer: C. Give the aspirin and notify the provider. Question 3. Which task is appropriate for the nurse to delegate to the LPN when caring for a patient with a suspected myocardial infarction? A. Interpret the ECG. B. Monitor vital signs. C. Initiate thrombolytic therapy. D. Perform patient teaching on nitroglycerin use. Answer: B. Monitor vital signs. Question 4. Which ECG finding indicates a possible inferior wall myocardial infarction? A. ST segment elevation in leads 2, 3, and AVF. B. ST segment elevation in leads V1, V4. C. T-wave inversion in leads I and AVL. D. U-wave presence in precordial leads. Answer: AST segment elevation in leads 2, 3, and AVF. Question 5. The nurse is assessing 4 patients. Which one should be seen first? A. A patient reporting new onset chest discomfort rated 8 out of 10. B. A patient with stable angina and BP 130/80 mmHg. C. A patient waiting for a routine lipid panel. D. A patient ambulating with mild fatigue. Answer: A. A patient reporting new onset chest discomfort rated 8 out of 10. Question 6. The nurse prepares to administer nitroglycerin to a patient with chest pain. Which assessment finding is a contraindication? A. BP 90/60 mmHg. B. HR 78 BPM. C. O2 saturation 95%. D. Complains of headache. Answer: A. BP 90/60 mmHg. Question 7. What is the priority nursing intervention after administering for morphine to a patient experiencing an MI? A. Document pain scale response. B. Reassess blood pressure and respiratory status. C. Offer the patient food and fluids. D. Teach the patient about the side effects of morphine. Answer: B. Reassess blood pressure and respiratory status. Question 8. Which lab result is most specific for confirming a myocardial infarction? A. Elevated creatine kinase, CK. B. Elevated troponin I. C. Elevated myoglobin. D. Elevated white blood cell count. Answer: B. Elevated troponin I. Question 9. A patient with MI is prescribed beta blockers. What assessment finding requires immediate attention? A. BP 110/70 mmHg. B. HR 50 BPM. C. Temperature 37 degrees Celsius. D. RR 18 per minute. Answer: B. HR 50 BPM. Question 10. Which patient care activity should the RN avoid delegating to a UAP? A. Assisting a patient to the bathroom. B. Measuring urine output. C. Performing a 12-lead ECG. D. Reporting chest pain. Answer: C. Performing a 12-lead ECG. Question 11. What is the primary goal of thrombolytic therapy in MI management? A. Reduce heart rate. B. Improve kidney perfusion. C. Dissolve the clot and restore perfusion. D. Lower blood pressure. Answer: C. Dissolve the clot and restore perfusion. Question 12. The nurse is teaching about sublingual nitroglycerin. What should the patient be instructed to do first when chest pain occurs? A. Lie down and rest. B. Take 2 tablets immediately. C. Call 911 after taking the first tablet if pain persists. D. Drink water to dissolve the tablet. Answer. C. Call 911 after taking the first tablet if pain persists. Question 13. Which dietary instruction is most appropriate for a patient recovering from MI? A. Eat a high-fat, low-carb diet. B. Avoid fruits and vegetables. C. Limit sodium and saturated fats. D. Increase red meat intake. Answer. C. Limit sodium and saturated fats. Question 14. What is the priority nursing action when a patient with MI develops a new S3 heart sound? A. Document the finding as normal. B. Reposition the patient. C. Notify the healthcare provider immediately. D. Encourage ambulation. Answer. C. Notify the healthcare provider immediately. Question 15. Which of the following best indicates the effectiveness of morphine in MI care? A. Patient verbalizes pain relief. B. Patient becomes drowsy. CHR increases. D. BP decreases. Answer. A. Patient verbalizes pain relief. Question 16. A nurse receives 4 patient reports. Which patient should be assessed first? A. Patient with BP 100/60 mmHg after nitroglycerin. B. Patient with troponin I level of 0.2 nanograms per milliliter. C. Patient with chest pain unrelieved by nitroglycerin. D. Patient awaiting discharge teaching. Answer. C. Patient with chest pain unrelieved by nitroglycerin. Question 17. What is the primary reason beta blockers are prescribed after an MI? A. Increase myocardial oxygen demand. B. Stimulate heart rate. C. Reduce cardiac workload and prevent dysrhythmias. D. Promote vasoconstriction. Answer. C. Reduce cardiac workload and prevent dysrhythmias. Question 18. A nurse is caring for a patient who is post-MI. Which activity should be delegated to the UAP? A. Monitor the telemetry readings. B. Educate on cardiac diet. C. Assist with bathing. D. Titrate for nitroglycerin. Answer. C. Assist with bathing. Question 19. Which symptom reported by a patient requires immediate follow-up after MI? A. Mild fatigue. B. Constipation. C. Shortness of breath. D. Occasional nausea. Answer. C. Shortness of breath. Question 20. What is the most important indicator that reperfusion therapy has been successful in an MI patient? A. Return of chest pain. B. Elevated CCAM-B levels. C. Resolution of ST segment elevation. D. Bradycardia. Answer. C. Resolution of ST segment elevation. Question 21. Which patient statement indicates a need for further teaching about myocardial infarction recovery? A. I will take my medications exactly as prescribed. B. I can resume sexual activity after my provider clears me. C. I should call 911 if I have chest pain lasting more than 5 minutes. D. I will avoid all physical activity for at least 6 months. Answer. D. I will avoid all physical activity for at least 6 months. Question 22. What is the best indicator that cardiac rehabilitation has been effective for a post-MI patient? A. Decreased troponin levels. B. Increased energy and improved exercise tolerance. C. Absence of chest pain. D. Patient remains on medication. Answer. B. Increased energy and improved exercise tolerance. Question 23. A patient is receiving 4 heparin post-MI. Which lab value must the nurse monitor closely? A. BINR. C. APTT. D. Platelet count only. Answer: C. APTT. Question 24. What is the rationale for administering oxygen to a patient experiencing an MI? A. To lower blood pressure. B. To decrease heart rate. C. To increase oxygen supply to ischemic tissue. D. To prevent infection. Answer: C. To increase oxygen supply to ischemic tissue. Question 25. Which clinical finding requires immediate intervention in a patient post-MI? A. HR 88 BPM. B. Crackles at lung bases. C. BP 128/76 mmHg. D. Mild headache. Answer: B. Crackles at lung bases. Question 26. A patient who had an MI is prescribed a stool softener. What is the rationale behind this order? A. To treat constipation caused by medications. B. To prevent straining that could stress the heart. C. To reduce abdominal bloating. D. To increase appetite. Answer: B. To prevent straining that could stress the heart. Question 27. Which nursing action takes priority when a post-MI patient reports chest pain after ambulation? A. Administer acetaminophen. B. Encourage the patient to continue walking. C. Have the patient sit down and assess vital signs. D. Call the physical therapist. Answer: C. Have the patient sit down and assess vital signs. Question 28. What is the nurse's best response when a patient post-MI says, "I feel anxious and like something bad is about to happen"? A. You're just tired, try to relax. B. I'll notify the healthcare provider right away. C. This is normal after a heart attack. D. Let's try some deep breathing together. Answer: B. I'll notify the healthcare provider right away. Question 29. Which instruction is most appropriate for a patient being discharged after an MI? A. Take your medications only when you feel chest pain. B. It is safe to resume smoking once you feel better. C. Avoid strenuous activities until cleared by your provider. D. Skip beta blockers if you feel dizzy. Answer: C. Avoid strenuous activities until cleared by your provider. Question 30. A nurse prepares to educate a patient on modifiable MI risk factors. Which is a modifiable risk factor? A. Age. B. Gender. C. Family history. D. Smoking. Answer: D. Smoking. Question 31. Which assessment finding suggests a complication of an MI? A. BP 110/70 mmHg. B. Third-degree heart block on telemetry. C. Pulse 78 BPM. D. O2 saturation 97%. Answer: B. Third-degree heart block on telemetry. Question 32. The nurse receives report on 4 MI patients. Which patient should be assessed first? A. Patient with nausea and abdominal discomfort. B. Patient with chest discomfort and shortness of breath. C. Patient who is anxious and asking questions. D. Patient requesting information on discharge plan. Answer: B. Patient with chest discomfort and shortness of breath. Question 33. A patient with MI is prescribed ACE inhibitors. What adverse effect requires immediate attention? A. Dry cough. B. Mild rash. C. Swelling of the tongue and lips. D. Headache. Answer: C. Swelling of the tongue and lips. Question 34. Which outcome best indicates that nitroglycerin therapy is effective? A. Decrease in troponin levels. B. Resolution of chest pain. C. Increased blood pressure. D. Bradycardia. Answer: B. Resolution of chest pain. Question 35. The RN is supervising a new graduate nurse. Which action by the new nurse requires intervention? A. Administering morphine to a patient with chest pain. B. Instructing the UAP to monitor for chest pain. C. Teaching the patient to check their pulse before beta blocker use. D. Asking the provider to clarify medication orders. Answer: B. Instructing the UAP to monitor for chest pain. Question 36. What is the nurse's priority when caring for a patient who received alteplase, TPA for STEMI? A. Monitor for signs of bleeding. B. Monitor heart rate only. C. Encourage frequent ambulation. D. Limit fluid intake. Answer: A. Monitor for signs of bleeding. Question 37. A patient post-MI is found unresponsive. What is the nurse's first action? A. Call a code blue. B. Check the carotid pulse. C. Begin chest compressions. D. Notify the family. Answer: B. Check the carotid pulse. Question 38. Which instruction should the nurse include in discharge teaching after MI? A. You can return to work immediately. B. Avoid all fats in your diet. C. Report chest pain that is not relieved by rest or nitroglycerin. D. Only take medications when symptoms occur. Answer: C. Report chest pain that is not relieved by rest or nitroglycerin. Question 39. A patient recovering from MI is showing signs of depression. What is the nurse's best response? A. You need to focus on recovery and not your mood. B. Depression is common. I'll notify your provider. C. Avoid thinking negatively. Stay positive. D. You should talk to your family about this. Answer: B. Depression is common. I'll notify your provider. Question 40. What is the expected action of clopidogrel prescribed post-MI? A. Prevents spasms of the coronary arteries. B. Dissolves existing clots. C. Prevents platelet aggregation and clot formation. D. Increases red blood cell production. Answer: C. Prevents platelet aggregation and clot formation. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.